Blood pressure is one of the most misunderstood numbers in aging. After 60, what many people believe is healthy can quietly become a risk if it is not properly adjusted to the body's new reality. The idea that lower is always better sounds simple, but the truth is far more complex. When pressure is pushed too low, circulation can become insufficient, especially to the brain, and that alone can trigger dizziness, mental fog, and even sudden loss of balance. As a physician, one pattern becomes very clear over time. Older adults are often treated using the same targets designed for younger bodies, and that mismatch creates problems. The cardiovascular system changes with age. Arteries lose some of their flexibility, and the body becomes less efficient at adapting to rapid shifts in blood flow. This means that a number considered ideal in a clinical chart may not actually support stability in everyday life. When blood pressure runs too high, the risks are well known. It can slowly damage the inner lining of blood vessels, increasing the likelihood of stroke, heart complications, and cognitive decline. But what is less discussed is the danger of going too far in the opposite direction. When pressure drops below what the body needs, especially in older adults, the brain may not receive a steady supply of oxygen. This can lead to subtle symptoms at first, like feeling slightly off balance. But over time, it increases the risk of falls, which remain one of the most serious threats to independence after 60. Another critical factor is variability. Blood pressure is not static. It changes constantly throughout the day, depending on hydration, posture, stress, and even digestion. In older adults, these fluctuations can become more pronounced. Standing up quickly can cause a sharp drop in pressure, a condition known as orthostatic hypotension, which is a major contributor to unexpected falls. This is why relying on a single reading, taken in a controlled environment, does not give the full picture. What truly defines an ideal blood pressure in later life is not a fixed number, but stability. A range that allows the heart to function without strain while ensuring that the brain, muscles, and vital organs receive consistent circulation. For many individuals over 60, this often means maintaining a slightly higher level than what would be recommended for younger adults, but still within a controlled and safe zone. There are also warning signs that are frequently overlooked. High blood pressure rarely produces immediate discomfort, which is why it is often called a silent condition. On the other hand, pressure that is too low can present itself in subtle ways. Mild fatigue, occasional dizziness, blurred vision when standing, or a sense of weakness in the legs are not random experiences. They are signals that circulation may not be supporting the body effectively. Over time, those who maintain a balanced and stable blood pressure tend to preserve their autonomy for longer. They walk with greater confidence, maintain clearer thinking, and experience fewer sudden setbacks in their daily routines. This is not about chasing perfection, but about creating conditions that allow the body to function reliably, day after day. Understanding this changes everything. Instead of trying to force blood pressure into a rigid target, the focus shifts towards supporting the body's natural needs. The goal becomes sustainability, not extremes. And once that shift happens, it becomes easier to recognize the habits that help maintain that balance, as well as the ones that quietly push blood pressure in the wrong direction over time. One of the most common mistakes seen in older adults is relying entirely on medication while overlooking the daily habits that quietly shape blood pressure over time. Medication has its place, and in many cases it is necessary, but it was never meant to work alone. When the body is constantly exposed to poor sleep, dehydration, high sodium intake, and chronic stress, even the best treatment struggles to create real stability. The result is a cycle where numbers fluctuate, doses increase, and yet the person still does not feel truly well. Hydration, for example, is often underestimated. As the body ages, the natural sensation of thirst becomes weaker, which means many older adults simply do not drink enough fluids throughout the day. This has a direct impact on blood pressure. When the body is dehydrated, blood volume decreases, making it harder for the heart to maintain consistent circulation. This can lead to sudden drops in pressure, especially when standing, increasing the risk of dizziness and falls. At the same time, dehydration can also trigger compensatory mechanisms that raise pressure unpredictably, creating instability rather than control. Sleep plays a similar role. Poor sleep does not just affect energy levels, it disrupts the regulation of the cardiovascular system. During deep, restorative sleep, the body naturally lowers blood pressure and allows the heart to recover. When sleep is fragmented or insufficient, this recovery process is interrupted. Over time, this leads to higher baseline pressure and increased strain on the arteries. For older adults, even small improvements in sleep quality can create noticeable changes in how stable their blood pressure feels throughout the day. Diet is another area where small choices create long-term effects. Excessive sodium intake is widely recognized as a contributor to high blood pressure, but the issue is not limited to obvious sources like salt added at the table. Many processed foods contain hidden sodium levels that accumulate quickly. On the other hand, a lack of potassium-rich foods can prevent the body from balancing sodium effectively. This imbalance can lead to both elevated pressure and increased stiffness in the blood vessels, making circulation less efficient. Physical activity, even in modest amounts, has a profound influence. Regular movement helps improve the elasticity of blood vessels, allowing them to expand and contract more efficiently. This supports smoother blood flow and reduces sudden spikes or drops in pressure. For older adults, this does not require intense exercise. Simple activities such as walking, light stretching, or gentle strength movements can make a meaningful difference when done consistently. Stress is often the hidden driver behind many of these factors. Chronic stress keeps the body in a constant state of alertness, releasing hormones that raise blood pressure and increase heart rate. Over time, this sustained pressure can damage blood vessels and contribute to long-term cardiovascular issues. What makes it more challenging is that stress does not always feel intense. It can exist quietly in the background, affecting the body without obvious signs until the effects accumulate. When these elements are addressed together, something important happens. Blood pressure becomes more predictable. Instead of sharp fluctuations, there is a steadier pattern that supports both physical stability and mental clarity. This is where many older adults begin to feel the difference, not just in numbers, but in how they move, think, and experience daily life. Understanding this relationship between habits and blood pressure shifts the focus away from quick fixes and toward long-term stability. It becomes less about reacting to high or low readings and more about creating an internal environment where the body can regulate itself more effectively. And within that approach, there is a specific range that consistently emerges as the most supportive for maintaining both safety and independence in later years. When discussing what is truly considered an ideal blood pressure for older adults, it is important to move beyond generic targets and focus on what actually supports function in daily life. For many individuals over 60, A systolic pressure in the range of 120 to 135, combined with a diastolic pressure around 70 to 85, tends to offer a balance between protection and stability. This range is not about perfection, but about maintaining consistent circulation without placing unnecessary stress on the cardiovascular system. What matters even more than the number itself is how the body responds to it. Some individuals may feel completely stable at slightly higher levels, while others may experience symptoms when pressure drops too low. This is why personalization is essential. A reading that looks acceptable on paper must always be evaluated in the context of how the person feels, how steady they are when walking, and how clearly they are able to think throughout the day. The goal is not to chase a universal number, but to support the body's ability to function reliably. One critical aspect that is often overlooked is the relationship between blood pressure and brain health. The brain depends on a constant and adequate supply of blood to maintain cognitive performance. When pressure is too high, it can damage small vessels in the brain, contributing to memory loss over time. But when it is too low, the brain may not receive enough oxygen and nutrients, leading to mental fog, slower processing, and reduced alertness. Maintaining a stable middle ground is what helps preserve clarity and cognitive resilience as the years go by. There is also a strong connection between blood pressure and physical independence. The ability to stand, walk, and move confidently relies heavily on proper circulation. When pressure fluctuates too much, especially when it drops suddenly, the body struggles to maintain balance. This is one of the main reasons why falls become more common with age. A stable blood pressure range supports the muscles, the nervous system, and the reflexes that keep a person upright and steady. Another point that deserves attention is how aggressively blood pressure is sometimes treated. In an effort to reduce cardiovascular risk, some individuals are guided toward very low targets that may not be appropriate for their stage of life. While the intention is to protect the heart, the unintended consequence can be reduced circulation to vital areas. This is why adjustments should always be made carefully, taking into account symptoms, daily functioning, and overall well-being, rather than relying solely on strict numerical goals. Monitoring patterns over time provides far more insight than isolated readings. Checking blood pressure at different times of the day, including after waking, before meals, and after light activity, helps reveal how stable the system truly is. This approach allows for a more accurate understanding of how the body is regulating itself and whether adjustments are needed. Consistency across these measurements is often a stronger indicator of health than a single ideal number. It is also important to recognize that the ideal range can shift slightly depending on individual conditions. Factors such as diabetes, kidney function, and cardiovascular history all influence what is considered safe and effective. This is why a flexible approach, guided by both data and real-world symptoms, tends to produce better outcomes than rigid targets applied universally. When the right balance is achieved, the benefits extend far beyond the cardiovascular system. There is greater mental clarity, improved energy levels, and a stronger sense of physical stability. Daily activities become easier, and the risk of sudden setbacks decreases. This is what defines an ideal blood pressure in later life. Not a perfect number, but a steady state that allows the body and mind to work together smoothly and consistently. Even when the numbers appear to be within a reasonable range, there is a subtle factor that can quietly undermine blood pressure stability in older adults, and that is how quickly it changes in response to everyday actions. Sudden shifts, especially when moving from sitting to standing, can place immediate stress on the body. When the cardiovascular system is not able to adjust fast enough, blood momentarily pools away from the brain, creating that brief sensation of lightheadedness or imbalance that many people dismiss as harmless. This response becomes more common with age because the mechanisms that regulate blood pressure lose some of their speed and precision. The nerves that signal blood vessels to tighten or relax do not respond as quickly as they once did, and the vessels themselves may be less elastic. This combination makes it harder for the body to maintain steady circulation during simple transitions. What feels like a minor inconvenience can, over time, become a serious risk if it leads to a fall or a sudden loss of stability. Another overlooked influence is meal timing and composition. After eating, especially meals high in carbohydrates, blood is redirected toward the digestive system. In some older adults, this can cause a noticeable drop in overall blood pressure, a condition known as postprandial hypotension. The result can be fatigue, dizziness, or a sense of weakness shortly after meals. Spacing meals appropriately and balancing them with protein and fiber can help reduce these effects and support more stable circulation. Temperature also plays a role. Exposure to heat, whether from weather or hot showers, causes blood vessels to expand. While this is a natural response, it can lead to a temporary drop in blood pressure. For someone already operating near the lower end of their ideal range, this can trigger symptoms more easily. Being mindful of prolonged heat exposure and staying properly hydrated can help maintain better control in these situations. Medications, even those not directly related to blood pressure, can influence how the body regulates circulation. Certain treatments for pain, sleep, or mood can have side effects that either raise or lower blood pressure unpredictably. This is why it becomes essential to periodically review medications and observe how they interact with the body as a whole. Subtle changes in how someone feels throughout the day can often be traced back to these interactions. There is also the role of breathing and oxygenation, which is rarely discussed in relation to blood pressure. Shallow or irregular breathing patterns can affect how efficiently oxygen is delivered throughout the body. Over time, this can influence heart rate and vascular tone, indirectly impacting blood pressure stability. Simple practices that encourage steady, controlled breathing can support better overall regulation and contribute to a more balanced internal state. When all of these elements are considered together, a clearer picture begins to form. Blood pressure is not just a number measured in isolation. It is a dynamic system influenced by movement, environment, habits, and internal regulation. For older adults, maintaining stability means understanding these interactions and making small adjustments that support consistency rather than reacting only when problems arise. This perspective transforms how blood pressure is managed. Instead of focusing solely on readings, attention shifts toward patterns, responses, and daily experiences. The result is a more complete approach that prioritizes safety, clarity, and long-term independence, allowing the body to operate with greater confidence and resilience as it continues to age. Over time, one truth becomes impossible to ignore. The numbers on a blood pressure monitor are only a small part of the story. What truly defines health in later life is how consistently the body can support movement, clarity, and independence without sudden drops or overwhelming strain. This is why the ideal blood pressure is not about reaching a perfect reading once, but about maintaining a steady internal environment that the body can rely on every single day. Aging does not require chasing extreme targets. It requires understanding what the body needs now, not what it needed decades ago. When pressure is kept within a balanced range and supported by stable habits, the cardiovascular system works more efficiently, the brain remains better supplied, and the muscles respond with greater coordination. This creates a foundation where daily life feels more predictable, and that predictability is what allows confidence to grow again. Small, consistent choices shape this outcome more than any sudden change ever could. Drinking enough water throughout the day, moving regularly, avoiding excessive sodium, and protecting sleep quality are not complicated actions, but they carry powerful long-term effects. Each of these habits contributes to smoother circulation and reduces the likelihood of sharp fluctuations that place stress on the body. Over time, these adjustments build a level of stability that medication alone cannot provide. There is also a deeper layer to this process that often goes unspoken. Maintaining a healthy blood pressure is not just about avoiding disease. It is about preserving the ability to live life on your own terms. The ability to stand up without hesitation, to walk without fear of losing balance, to think clearly and stay present in conversations. These are the outcomes that truly matter, and they are directly influenced by how well the body maintains its internal balance. It is important to remember that no single number defines success. What matters is how the body responds over time. A slightly higher reading that allows for stable movement and clear thinking may be far more beneficial than a lower one that introduces weakness or instability. This shift in perspective allows for a more realistic and sustainable approach to health, one that respects the natural changes that come with age rather than fighting against them. Consistency, awareness, and respect for the body form the foundation of this approach. When these elements are in place, blood pressure becomes less of a constant concern and more of a manageable aspect of daily life. The focus moves away from fear and toward understanding, creating a sense of control that many people feel they have lost as they age. The path forward is not complicated, but it does require intention. Each decision made throughout the day contributes to the body's ability to maintain balance. Over time, these decisions accumulate, shaping not only cardiovascular health, but overall quality of life. This is where true strength lies, not in extreme measures, but in steady, thoughtful care. Aging does not have to mean becoming fragile or dependent. With the right approach, it is possible to maintain strength, clarity, and independence for far longer than most people expect. And it all begins with understanding what the body truly needs, supporting it consistently, and allowing it to function as it was designed to, with balance, resilience, and quiet strength.